For my fellowship, I went to a country that most of you have probably never even heard of, spelled Lesotho but pronounced Lesotho. A tiny country completely surrounded by South Africa, Lesotho should not be discounted simply for its size or anonymity. The Basotho people, the homeland tribe, are warm and often rather shy mountain people. Whether it be herding mountain goats and cattle, visiting rural mountain villages, cooking pop, or growing mohoro, you can be sure you'll find a smile in Lesotho wherever you go, wherever you initiate one. But the Basotho are also very strong people. They have endured some of the heaviest disease burdens in the world under completely impoverished conditions and political upheaval, all with nothing but gratitude, faith, and determination. Today, Lesotho has the second highest HIV prevalence in the entire world. 1 out of 4 people are affected, and 1 in 3 women. The list of health problems stretches on. High incidence of tuberculosis, maternal and child health deficiencies, vaccination, birth, gender-based violence, and safe livelihoods. The list stretches on. None of this is helped by the government, a dictatorial coup that hoards money as they hoard power, restricting press and killing dissenters as they please, or the lack of water, or the food insecurity, or the violence of the urban capital, Maseru. That's where I went, to Maseru, working with Japaigo, a nonprofit affiliated with the Johns Hopkins University. My name's Jasmine Uysal, and I'm a second-year student in the Department of Community Health Sciences, and this is my story. In Lesotho, I took part in research at the intersection of maternal and child and sexual and reproductive health. Not simply as an assistant, but as a lead in my assignments. Every day I got to work alongside Japaigo's staff, completely made up of local Basotho experts. From working in the office to traveling into the field, I learned how to interact with those from another culture and the impediments global organizations face when operating in environments that place glass ceilings on their progress. My projects focused on the competency of Lesotho's nurse midwife workforce to handle the HIV/AIDS epidemic and newborn care crises. I conducted evaluations and completed research reports in conjunction with our funders, UNICEF and USAID. I was even given the chance to present my report to UNICEF, and I'm now working on publishing my results in peer-reviewed scientific journals, and I'm submitting an abstract to the IAS Conference on HIV Science in Paris this 2017. I mean, as a public health student just getting her start in this world, how could I ask for a better experience? But this is not a fairy tale. It's a story of a real life, my real story. And as often happens in real life, my story takes a turn for the worst, or what seemed to be the worst at first. Only 1 month into my internship, 4 measly weeks, on the way walking to work in the cool morning mountain air, I was run over by a van. I was knocked unconscious, taken to the hospital, and though it was a painful process to diagnose, I was eventually diagnosed with a serious concussion and skull fracture. So, how exactly was I able to complete my projects after being seriously injured in the first month? Well, the answer is as reckless and crazy as it was stubborn and fearful. I stayed in Lesotho after my accident. You see, this had been my dream for so long, and it's always felt so far away. To be in a place making a difference with people that have so much to teach me. I couldn't bear to tear myself away. So I dug in my heels, snapped on my stylish Miami J neck brace, and after a brief reprieve, headed back to work. At the time, the doctor I was seeing had said this was okay. But looking back, this wasn't terribly smart. And I suffered from my idealistic stupidity, both physically and emotionally. But where I suffered, I also grew. I learned lessons that no internship could have ever taught me about what it takes to advocate for your own health and your own life. My own limits, and the extent of my privilege. Through my suffering, I got a glimpse into the struggles that Basotho people face every single day. I was taken to the only hospital in the country with a working CT scanner, and it still didn't catch my neck fracture because it looked about 20 years old. When I had strange nerve symptoms, numbness in my limbs, and extreme vertigo, there was no ambulance to call. At 7 p.m. on a Thursday night, it took me 5 hours to get to the hospital. The most common response I got from Basotho people when I told them about my story was how lucky I was the man who hit me had taken me to the hospital, because without a viable police force, who is there to punish for hit and run anyway? Above all of this, I learned what global health inequity really means. It means that I live while other people die. That in our global economy and reward structure, that my life is valued more than theirs. When I was first taken to the hospital, I had no problem being admitted to the emergency room. The color of my skin opened doors on the assumption that me or someone I knew had the money to pay for my services. But at the same time I was admitted, I saw an elderly Basotho man walking into the hospital. He had a similar head wound to mine, was bleeding actually much more profusely, but they would not admit him because he did not have the $7 to pay for his care. Let me repeat that. His entire life, his right to existence, was not worth the $7 most of us spend at Starbucks each morning. While paying for his bill eased my personal guilt at the time, it has done nothing to erase the gnawing in my stomach, the knowledge, the vision that the lack of global health care and global inequity is killing people, real people, people you can see and touch and feel and love. I often wonder if that man is still alive today. I often wonder if I would still be alive today if I were from Lesotho. Through all these experiences, the good, but especially the bad, I learned what it takes to work as a global health professional and face these realities day in and day out. It takes grit. Thank you.